In this morning's Health Watch, big changes in healthcare. Parts of the landmark legislation signed into law in the spring go into effect today. So what does that mean for you and your coverage? Here to break it down for us, CBS News Business and Economics Correspondent Rebecca Jarvis. Good morning, Rebecca.
Good morning, Maggie.
Now, there's a lot of confusion about when all this goes into effect. Some things don't go into effect until 2014. Others don't go into effect until January. Just to be clear, what we're talking about today are things that go into effect today, immediately.
Absolutely, and there are a lot of measures that do go into effect today, so we'll talk about those.
Okay, for example, what is changing right now in your plan?
If you are under 26 years old right now, you will be covered under your parents' plan. Also, if you're under 19 years old, you're a child under 19, your parents' coverage, the family plan, will cover you even if you have a pre-existing condition. Now, what also has sort of happened as a result of this is that the insurers have found a way around it. They're not offering child-only coverage that would cover children with pre-existing conditions.
But you can stay on your parents' plan until you're 26, even if you're married. It doesn't matter whether you're a dependent or not.
Your status as an individual makes no difference. It's a matter of you're 26.
Wow.
That's the bottom line. You're taken care of.
So that's a substantial increase in coverage.
Yeah.
Now, are insurance companies still allowed to limit how much they pay you out in benefits?
No. The quick answer is no. Over time, this is going to be phased out completely. Right now, or previous to this legislation, you could have a cap on the total limit of compensation from an insurance company over your lifetime. They are phasing out those lifetime caps. Also, on top of that, they are phasing out policies being rescinded. So what used to be the case is if you got really sick, a company could come out and say, the insurer could come out and say, we're not going to cover you anymore. They are phasing that out as a part of this legislation. Now,
eventually, everybody will have free preventive care. But right now, if you want that, you have to sign up for a new plan?
Yes, new plans are going to be covering preventative care in terms of like mammograms, for example, blood testing, that type of thing. So assuming that you pick up a new plan after today, you'll get that for free.
It all sounds almost too good to be true. So are you going to have to pay more premium-wise to get all these benefits?
Premiums do look like they're going to be rising. The government says we're going to see something between 1% and 2%. And also doctors are seeing the impact already. They're saying we're not getting a lot from the insurers. Our reimbursements from the insurers are going down, so we can't see as many patients. Some are opting out of insurance, and other doctors are saying our offices are going to be busier as a result of this.
All right, we'll see how it plays out. Rebecca Jarvis, thank you, Rebecca.
Thanks.